just want to do a little quick update on direct primary care or concierge medicine in general. The current insurance climate out there is not great for most providers, especially those providers who are doing primary care and or most of their revenue, their clinic revenue is all clinic-based, not hospital surgery-based, etc. You can see this. There are a lot of doctors who are becoming social media influencers out there. Most of them have amazing stuff out there at the moment, but no one's been very shy about the current state of insurance reimbursements. They're getting lower and lower. Most doctors I know right now are getting paid less per office visit than doctors in the 90s were, with more staff, more overhead. And more inflation, right? More inflation. And electronic records, those didn't even exist in the 90s. Like, it's crazy. So, what's the point of this video? The main point is you're gonna see a lot more direct primary care, concierge care clinics popping up because these doctors are recognizing that they have two choices. One, they can try to find a way to survive with insurances that are paying $20 to $50 per visit. That means for you, the patient, you're looking at 5 minutes with your provider. You know, you might have a 15-minute appointment, quote unquote, but by the time the nurse checks you in, gets you all ready, the provider has time to address your one concern, and then the nurse checks you out, because you also have to be scheduled for your next appointment, do labs, etc. You're getting about 5 minutes of quality with your provider. So what do they do to survive? They say one appointment, one problem. Or one problem per appointment, I guess that's a better way to say it. The problem here is that so many issues all interconnect. They interconnect, and so you don't realize it until you talk about the third or fourth problem that you realize that's connected to the first problem. And not only does it connect, but it gives depth of understanding to it. And instead of ordering a billion tests, you now realize you only need 2 or 3 to confirm what you're suspicious of. You get people better faster by getting to the root cause. So you're gonna see a lot of providers realizing that, hey, I, as a provider, prefer to take care of people, to get to know them better, and not to just be this kind of mill, just driving people through like cattle going to the slaughter, you know? It's just not the way they're built. Now, nothing against the doctors who are able to do it. In fact, it's amazing that there are some people wired that way. They're like, yeah, let's go, this is what I thrive on. And people need care. But you're gonna see a lot more direct primary care popping up. And there's gonna be direct primary care and direct primary care that also adds in functional medicine or internal medicine docs that are doing some sort of concierge program, and they have a functional emphasis as well. And so as you're looking at these various clinics, just kind of recognize what's all in there. You know, one doctor might be doing purely primary care and charging $300 a month for that. Another might be charging $500. I've even seen doctors who are charging, you know, $1,500 a month. But you got to look at the services. It's not just for routine primary care. They might even have their own lab, their own x-ray. It just kind of depends on what they build their clinic out into. The one recurring theme, though, out of every doctor I know who does some form of concierge or direct primary care type setup, they have consistently reinvested their funds right back into the clinic. Almost everyone I've ever seen has not been in a get-rich-quick scheme. Their goal is to take care of people, keep the lights on, and to grow the kind of services that they're able to provide. So as patients are investing, they're not just investing in their own health for office visits, but down the road, or those options grow to a point where now you see clinics that have a lot more access opportunities. So just want to encourage you, as you see more of those pop up, keep an eye out for them, and just recognize that there's going to be a lot of options within that, and try to get some information on what's included in membership, or what are the goals for the clinic, or how do they care for people. So if you're hunting around, looking for different places, shopping a little bit, hopefully that helps you a little bit. But either way, beautiful views today, a little cloudy, but it's a nice day for hiking. Hope you're having a great day out there. More updates during training coming to you soon.